Aloha and welcome to Muro's Temple, the podcast, where we explore the deeper work behind our Hawaii location and online platform. I invite you to join me as we return home to your body's feminine wisdom.
All right, welcome back to another episode of Muro's Temple. This series is a continuation of Women Healing Women, and I'm so excited to have AnaBelen with us. She is a beautiful woman based in Oahu, Hawaii, and I met her while living there. And I love the way that she has been able to merge the holistic aspect of healing with more of the modern medical approach. So I'm going to hand over the mic to her. And Anna, can you just give us an intro of how you work and the magic that you do?
Thanks. Hello, everyone. Thank you for having me, Celeste. My name is AnaBelen Taylor. I graduated from UCLA with my master's as a family nurse practitioner, and I practice in primary care. Currently, my career mission and approach is to help women, empower women to become the CEO of their health and guide them in this medical world, which I believe can be confusing for women. And it's hard to find holistic providers to meet them where they are in their current health, or if they're having any symptoms where they might not find the answers in their current medical world. So I'm kind of the person trying to bridge both worlds together, if that makes sense.
And can you share a little bit of your background in terms of the holistic healing aspect?
Yeah, so I grew up with my grandmother, and she taught me a lot about herbs and a lot of shamanistic healing practices that when I was younger I did not care about. I moved to the States when I was a teenager, and when I was in California I developed a lot of hormonal imbalances, and I could remember her, telling me the things that I should be doing with my health, right? And I was doing the opposite. So at that time, when I was a teenager and when I went to college, I embarked on this journey to figure out my PCOS, basically how to find the cure for it. It's a very complicated topic and issue. And it's very common, maybe like 20% of women in America have PCOS in their lives. And I don't like medication. No, it's very weird for me to say. I am not into pharmaceutical drugs, right? But yet I'm in this field where folks come to me for actual prescriptions for pharmaceutical drugs, which I believe, they do have, you know, they are useful in certain times, right? But I think our current society, we believe too much in pharmaceutical drugs or give the power to all these drugs to kind of help us and heal us when they're not going to do that. So I always been holistically driven in that way because of the way that I was raised, right? So I went to nursing school, I got my bachelor's. Even though when I was practicing, in a hospital, I was seeing kids die. I mean, all kinds of horrible things. I knew there was a better solution to the problems we were dealing with. And I think everything I would see that's very common was pain and trauma. So I was always very curious to figure it out how the trauma and our pain actually played a big role in our physical health, perhaps. So I went to learn integrative approaches and also obtain more information from shamanic healers and learn their practices and their concepts of women's health. So that's where I got that from, I believe, mainly. And I still practice a lot of things that I was taught in, in the settings. And then when I went to school, I learned a whole Western allopathic medicine approach, which I think it also serves its purpose. I think both can be combined in our current society. So, yeah, does that answer your question in an odd way?
Yes, for sure. And so I love that you have, I feel like this is the next form of medicine, like this next generation being able to merge the two worlds and receive the best of both sides. Yeah. So, can you share maybe some of the things that you feel are most common amongst women when they come to you, maybe in terms of maybe they approach you wanting support with something, and knowing your background, you're able to support them and see a whole new aspect of what's actually going on in their body and what's a real solution, as opposed to maybe what they were thinking they might have Googled or heard from a friend.
Right. That is very common. So first, I think one big topic is STDs, right? Sexual transmitted disease. It's on the rise and it's very common. And I don't think any woman, embarks on a sexual encounter to think they want STDs, right? So there's something else going on there itself. So when you come into the clinic, you have all the symptoms that perhaps 80% of the time it is an STD and the other 20% is not. So, as a whole, when I see a woman and I ask them, did you know, did you use protection? And I think it's a world now that we're living about liberation and this feminism world, which is totally understandable. Everyone has their choice. I think we have to be more responsible about our space and how we protect our energy, not just, sexually, right? Yes, you're going to get an STD if you sleep with so-and-so and you're not be careful. But I think also energetically, we can absorb so much from a male partner that we're not aware of. So even though we might just get an STD, you get diagnosed with gonorrhea or chlamydia, there's medication for it, you feel better. Then you come back later, maybe 2 weeks later, with other symptoms that do not have to do with STDs, perhaps. It could be your vaginal discharge or bacterial vaginosis, which is a bacterial infection. And you can have it recurrently for so many months and years and never go away. So, in a allopathic Western medicine world, yes, there's medication for it. You'll continue to get prescribed this medication over and over again. So when I meet them, I guess I'm very intuitive. I can sense a lot from each person I meet, especially in the clinic. And I can sense when their heart is blocked or there's something else going on. So sometimes I ask them, what else is going on in your life? How did you feel about this encounter? Or what did you even choose to be with this partner? And then I get funny answers or like, I don't even know, he was not even good. It's really interesting, the answers I get from women. And I said, yeah, what makes you think, why do you think you embark on these experiences that maybe you didn't receive anything from? Have you ever thought about that? So that's like one step, I guess. It's like a little seed into their mind and then their heart to start figuring it out. She mentioned something that I actually never thought about. Why did I embark on this experience that I got nothing from it? I'm not saying you have to get something from every experience, right? Because we shouldn't be all about taking. But if it's an unhealthy experience where maybe it was not right for you, we have to question the reason why we actually embarked on it on the first place. So I think that's always one starting point for women to start realizing how maybe there is a trauma background in their mind playing, making those decisions for them, right? So in our current healthcare, we have something called ACE questionnaire. Are you familiar with that?
I am not. I'm not. I don't spend much time in the medical world.
So it's very like it's actually used a lot. It's called the Adverse Childhood Experiences Questionnaire. So even in our allopathic Western medicine, we get taught about the social health determinants of every individual, and we have to bring those aspects into making decisions to create a better treatment plan for them, right? So if I treat an individual who was raised in a nice neighborhood, right, with everything opened and available to them, then the approach might be different in treating them versus having someone else that maybe didn't have care or any available opportunities for them. Then you have to treat them differently because the way they were raised, the way their environment created who they are as they are now, as a grown up, as an adult, or as a grown woman, right? You can either be 18, 21, or 30, but those experiences are still within you. You're carrying those experiences, whether they're good or bad. So those experiences shape us. So this questionnaire focuses on trauma itself. If you were raised, with emotional abuse or physical abuse or sexually abused or touched inappropriately, or with alcohol in your house or with a dysfunctional household. So those aspects play a big role later in life, because they say about 50 to 60% of adults actually experience at least one adverse childhood event. And that plays now in our current research shows that almost a lot of the chronic conditions that we're currently having and are not getting better, even in women, especially women, are more prone to them, like ovarian cancer, cervical cancer, breast cancer, are due to these events that happen when we were a child. So even though, we're supposed to ask these questions, many providers don't ask those questions. There's not the time allotted for that. If you're here there for 20, 30 minutes, and there's a lot to unpack. These questions can bring a lot to a person. They're very personal, and you're touching on a subject that maybe they've been kind of burning down for so many years. And sometimes it's hitting somewhere because you're trying to kind of bury that pain that you felt when you were a child. So that's always one step, I think, in our everyday practice, how we're missing the connection between kind of spirit, mind, and soul, and the body connection. We're just focusing on the body itself. But I think trying to teach women how to remember their soul and mind connection to their body plays a big role. We couldn't have a body without a soul or a spirit, and vice versa, right? So we cannot separate, our organs and bodies and soul and spirit into different sections. It doesn't work that way. Obviously, we know that. So my approach is to kind of go back to the root cause, go back to the beginning, I call it, to the beginning of time, perhaps, the experiences you had when you were a little fetus in your mom's womb. Like, what did your mom experience? Perhaps you feel you don't belong in this world when you're older. These experiences can be developed into depression, anxiety, and then you are driven into this path of having these physical symptoms, and you're put on medication, and those medications can cause side effects. And those side effects could be hormonal imbalance, or you can have more recurrent infections. We know that birth controls, for example, women have a lot of recurring urinary tract infections or yeast infections. So I guess my point is for you to see how everything connects eventually. It's very, very circular. It's not very linear in a way. It's a circular approach, I guess. When you look at a holistic approach, it's more circular. Everything's going to connect. It's the cycle of life in a way.
Oh my God, I love everything that you just said. I wrote down so many notes because I think this is so important, especially coming from someone like Hugh, who is in the medical field and has seen both sides. And you have that experience of being sensitive and intuitive and understanding the energetics, but also practicing within the medical industry. And I just want to take the conversation a little bit back, because these are big topics that I feel, at least for me, like I mentioned before, I've always been, since I was little, very shy and kind of not welcoming. Like, I don't like hospitals and I don't like doctors, and I've just never felt comfortable in those scenarios, so I felt shy from those experiences. But because of that, it forced me to really take a full responsibility for my health in different ways. And so the way that I work, you probably already know, is I mainly work with energy in terms of healing. And so when women come in for healing, it's exactly what you're saying, but it's almost reverse. Like, they'll come in because they have anxiety, and then we open up the space and we do the energy work. And I'm like, oh, there's womb patterns in your life that go back generations. And so they're coming in for anxiety, and I'm tracing it back to this whole other thing that, they're like, I don't want to go there. Right. But I love that you're able to see that and make those connections, and also empower women. And especially, like you said, just something as an STD or a UTI, stepping outside of the immediate, like, yes, we have to treat the thing that's in front of us that's causing problems, but can we go deeper into why it's happening and what are some of the repercussions that it may be causing in the rest of my body? And I see that a lot, specifically again with energy healing, where there's like a hormonal imbalance, but it's also like a side effect from a lot of things that they're putting into their bodies. And so yeah, I love everything that you're doing. And also, can we also go back in a little bit with the trauma, because that's been a big thing for the temple since opening. Like, a lot of women that have come in not even realizing that they're carrying trauma, and like you said, they perhaps grew up in an environment where they didn't even perceive their experiences as traumatic. Or a lot of times what happens as energy sessions is they come from a time in the womb where their mothers didn't feel safe, or there's generational trauma. So can you talk a little bit about maybe your approach, and or how you bring that up, or how you see women, how you move through that process? Maybe a woman doesn't feel comfortable approaching it from the space of energy, but maybe more in the medical terms. Like, how would you deal with that?
Yeah, and I think it's very common. Usually, many women are not open to the energetic kind of world, or they're just not, or they're new, perhaps. I do see a lot of younger individuals, maybe 18 to 25, and then I also see another range of women that are in menopause. So this, and then a few in the middle. So I see the different ranges of, I guess, the state of, I call it the current state of your feminine health, right? So it varies. Everyone's in a different stage. Everyone has different faces, which is totally fine. But I think, for example, if I have a woman come in and they're saying I have pelvic pain, right? And I am having vaginal discharge, we always have to do a pelvic exam, right? Most women do not like go to the doctor. Actually, I don't even like going to the doctor myself because I've had experiences where they're not welcoming and they're very dismissive, right? They kind of want to tell your symptoms are not a big deal when you feel there's something else going on. So I totally I empathize with women and patients when they're kind of anxious and nervous about coming into the clinic, because I also have those same experiences, right? So when I have them come in, even before I do a pelvic exam or even get into the subject of the reason they're there, we kind of go about talking about, again, the questions first, the very basic questions, not surface, I call it surface level questions, because maybe I can sense maybe this person's not going to be ready to dive deep down to this, and maybe it wouldn't be a good idea, or it's not a healthy approach for them. So maybe just surface questions like, have you had a pelvic exam before? How did you feel about that experience? Was it very painful? Did you not enjoy it? Was it traumatizing for you? Is there something that are you concerned about this experience, right? Or is there something you want me to know? Maybe any sexual abuse in the past that I should be mindful about, or any way you want to lay down on the table, an exam table. If someone has been sexually abused, it can be a lot to sit on this exam table with this curtains and this very bright white lights, and they can trigger something for them. So you kind of start from there to make sure you make them feel comfortable and realize that you are aware of what maybe they have experienced. And even though they might not want to talk about it and it's not the time, that's totally fine, but at least make this experience less traumatic than the past experience. So that's always one big step to take. Ask about, also in a surface level, ask about their mother. How many other sisters do you have? Do your sisters or mother have the same symptoms? And then sometimes I come up to find out, many women in their family have hormonal imbalances or pelvic pain or fibroids. And I'm like, oh, interesting. And I kind of just weave in and tell them, did you know about this? Right? It's very interesting, because it always blows my mind, actually, when I tell them about how when like our mother, for example, all her eggs were developed when she was inside my grandmother's womb. And they're like, really? I'm like, yeah. So if you think about it, when even before you were born, you were inside your grandmother's womb. So whatever she experienced, that means that your mom and you are carrying that. It's called epigenetics, right? There's actually scientific evidence about epigenetics. You carry these genes in your egg cells, and you might even know why you might feel a certain way. Like I had this actual insight maybe a few weeks ago, a month ago. So usually people bang on my door very loud, and that always like I get so jumpy, and it takes me into this very nervous, anxious moment. And I never realized why. I was like, why does this happen? I don't understand why this banging in the door takes me to this weird level, right? And then when I did some digging with my mom. When my dad was part of the military, he used to drink a lot of alcohol. He used to come certain nights when she was pregnant and bang on the door very loud. So my mother, that was very frightening for her. And then when she explained it to me, I was like, oh, that totally makes sense. Because I never understood for a long time why this loud banging sounds just drive me into this anxious mode. And I didn't even know what's going on. So that just shows how we can kind of do the work, try to connect. Why are we feeling this, right? I had no idea why this kind of trigger was bothering me and driving me into this sense of anxiety or panic. So it must be that something got passed down from my mom and then maybe to my future daughters if I don't work on it, right? So I think it's something that it's in the science, epigenetics. We pass down our genes, even the trauma from our grandmothers, to our moms, to us, and our future daughters, because it goes back, they say 7 generations back, 7 generations forward, right? So I think it's very amazing when I tell women that. They're like, it's a very big topic in a way, but it's very, when you put it into words, they're like, that is pretty crazy, right? To think that, your mom had all her eggs she would ever have in her womb when she was in my grandmother's womb, and so forth. My grandmother had all her eggs when she was in her mother's womb. So I think just bringing that topic opens your eyes that there's more than to the now, right? It is important we focus on the now, but I think when we don't understand certain things, we have to go back and realize what are these connections. We are connected. Our women line, for our feminine sisters or the line of sisters that we have having similar symptoms, or our mothers, then we have to ask ourselves, like, what is that is connecting us to the same symptoms and connection? And I think that's very important when I tell women that, because maybe they'll go home and they were like, this crazy provider was telling me about eggs and so, and she probably thought I'm crazy, which is fine. But then she'll realize, that's actually true. There is epigenetics, and she's actually not all crazy. And then maybe she'll dig deeper and then start her path in this new journey. And I always feel like you always plant a seed into someone that you meet, that maybe that moment will be not, it won't be now, that it will bloom into their new path, but maybe it will be later, right? So I think that's kind of, I've woven into this world of making sure women have like a trauma-informed care, right? I asked them, I think trauma plays a big role in our lives, especially for women. Trauma can be the trigger for a lot of autoimmune conditions, pelvic conditions. So I need to ask these questions so I can do my best to help you in the journey, right? So women, even before the pelvic exam, asking the women, do you give me permission, to enter the speculum in your vaginal area? Are you okay with that? And even sometimes that triggers women into crying, and they feel like, what is going on, right? Because they probably never got asked that, and they probably never had someone ask them, like, do you want to sit in a specific area or lay down a specific, whatever, certain things, small things make a big difference. And I think whatever the words I use or whatever approach I use, I think intuitively I get that for a reason, because maybe I'm getting something from them. And when they open up or they start crying, or I had women start shaking, and I might just be doing a regular path, then I know there's something more going on, and I'm not going to continue. And I think, maybe we can treat this then that way, and then let's focus on, why you're feeling this way, and let's come back to it, and so you can have some time to figure out, why you're feeling this and heal that part of it.
Oh my God, I love it. I got chills and I almost started crying because
Mm.
just the honoring and the respect that you think that you're taking with patients, I think is huge. And I feel like we so need that. And you had said something about women being traumatized in doctors' offices. And I see that a lot when that conversation is available, because like you said, sometimes it's just not appropriate to bring up that conversation because it's so heavily seated in the emotional body. But when women are in that place where they can express, and to hear that they're being traumatized from these, quote unquote checkups is just insane. So I appreciate your approach. So sort of bringing this conversation to a close, what would you say to maybe empower women? So maybe women, perhaps even like me, who in the past are like, I'm not going anywhere near a doctor who's going to just, not understand my point of view, or just empower them on their healing journey, whatever's going on in their life. Maybe it's just, I haven't had a checkup and I don't want to go, or I have an STD and I'm ashamed, or I don't even know what's going on in my body, or I know exactly what's going on in my body and I don't want to go deeper. What are some things you want to share?
I think, the shame part, I think it should be eliminated. I feel like no woman should be eliminated. I mean, sorry, no shame should be eliminated. No woman should feel the shame, in regards to STDs. I think no one's going to be shaming them. It's, in the medical world, it's very common. So we never think of a woman coming in and be like, how dare you? It's not even connected to that. I think it's more very scientific in the medical world. Like, okay, STD, done. Here's medication. You're done, right? So there's no shame in that. I think there's no shame also, if you want to be on birth control, whatever you choose, I guess, in your current stage in life, there shouldn't be shame about it. I think it should be accepting where you are in life and being okay with it. Because the more shame you kind of have around what you choose for yourself, then you just create more stress, and then that just leads to more diseases and more symptoms. So you have to come kind of accept this, the way you are. I think is very important, and the choices you make, whichever choices they are. And then let's say if you don't want to go to the doctor's office, and you can tell them, say, hey, I heard about trauma informed care. Is that something that you do? And if they're like, what? And I don't, then find a different provider, right? So those are big questions because that exists in the medical literature. I think every medical provider is aware of trauma informed care. So you have the right to ask patients and clients. You, as the person you paying, even if you're paying with insurance, it doesn't matter. You have the right to ask the care that you want. I think for so long, we just, the healthcare system, it needs a lot of work. But I think also needs women, and more clients to be more empowered and demand best for themselves. I think you should be able to know what's best for you. If you need to fight, for yourself, for whatever symptoms you're feeling, always get a second opinion. There's always going to be someone along the way that is going to be willing to help you. And I know we get dismissed a lot as women in the healthcare world because it's just the way it's been for so long, right? So I think you need to learn about your body, right? That when you're healthy, know what it feels to be healthy. And if you're currently maybe not living a healthy lifestyle, maybe if you're smoking, drinking too much, maybe there's a few steps to take back and maybe consider stopping, or the reason why you're going on those patterns, right? So that's always a good place to start to be the CEO of your health, kind of acknowledging that maybe certain patterns are not healthy, and then realizing what you can do to break those patterns, and sometimes go back to why you're creating those patterns for yourself. I think it's very important because in the long run, no one's going to be the best healer than your own self. No one's going to have the best, kind of care the most than yourself. You have like the best, you know what's wrong with you, you know what works best for you. So you kind of just have to take the responsibility because it's huge. So you would have to make different lifestyle choices, as hard as it seems, but that comes with the responsibility, right? So you can expect to be healthy and go to the doctor's office and they're not going to heal you. They're not going to change your life. The person who's going to change your life is going to be yourself at the end of the day. If you make better decisions around your health, emotional health, there's nowadays, the amazing thing, there's so many different approaches, and we have more open talks about, your mental health, mind, body, soul connection. So I think it's exciting, and I think it's a good time to trying to dig deep of what is it that you want out of your life, and your health. I think they both go together, life, your meaning of your purpose in life. You also need good health to accomplish those purposes and your mission in life. You cannot be unhealthy and kind of drive this mission when your body is not nourished the right way, when your brain is not nourished, when your mental health and your soul and your spirit is not nourished. You will not be able to live a very fulfilled, happy life, even if you reached your mission goal, I guess.
Beautiful. I love your perspective and the way that you just bring everything together in such a beautiful, holistic, and very modern and medical way. So thank you. It's been a beautiful conversation. I love what you're doing, and I will share your work with anyone who's local in Hawaii, and we'll add your information so they can get a hold of you there.
Sounds good. Thank you for having me. I really love doing this talk.
Yes, thank you, AnaBelen. You're amazing.
Thank you. I love you and I miss you.
Miss you too. I'll see you soon.
See you soon. Bye.
Bye.
Mahalo for being here with me today. And as usual, if you'd like to learn more about what we do at our Hawaii location or online, explore the courses, the mentorship, or the events, go to www.murosetemple.com. See you soon.